This is the next in the series with Chats with Mayor Matt. I've got a special guest in the office/studio where we are socially distanced and adhering to all of the guidelines set forth by Knox Public Health and the state of Ohio, governor's orders. But with me today is Carmen Barbuto, who is with Knox Public Health. She's the accreditation coordinator for Knox Public Health and does all sorts of things in terms of community assessments, the Knox Health Planning Partnership, and a whole sundry of other things here. So welcome, Carmen.
Thank you.
Okay, we're going to talk about the census and
Yes.
what this means to public health in Knox County and why this is so important. So you use the census all the time.
Yeah.
So can you talk a little bit about
All the time.
what is in your world with the census?
Yeah, so the census for us, we literally use it for something as simple as making sure we know how many people live in Knox County, to things as complex as our racial breakdown, our gender breakdown, our income breakdown. So sometimes we look at it just really briefly and we're like, okay, we got to know how many people are living here. How much has it changed? And sometimes we really get into the weeds of it and we look at, breakdowns of all of our demographics, our socioeconomic status. So it really depends on what we're needing it for, how deep we'll get into it. But the census is full of data that we use. I would say for me, I use it on a weekly basis. For the rest of our staff, I would say at least on a monthly basis. So it's very important to the work that we do.
And so what sort of decisions go into your life when you look at the census? What are you looking for?
We're looking for any issues. And when I say issues, it's not in terms of, we have a high low income population. It's we're looking at what gaps exist. Do we have gaps in how many people have health insurance? That's something that the census looks at. We're looking at how many people are renters versus homeowners, because believe it or not, safe and affordable housing is something that public health looks at. It's not something that Knox Public Health looks at very in detail, but it is something that we pay attention to. A lot of times for us, we'll look for like when we write for grants, we want to make sure that we're capturing, the audience that we will be serving with that grant. So for example, we know that we have about a 15% poverty rate in Knox County. So when we write for grants, we use that and we say we have, this percentage of our population, which equals X amount of people experience poverty or they are considered low income by the federal government. And using this grant, we'll be able to help them through A, B, C, and D, because we know a lot of times our low income residents have poorer health outcomes. They don't have access to healthy food. A lot of times they're smokers. They don't practice routine preventative health care. So knowing that poverty percentage is a really big, important number for us. And we'll utilize that in any grant that we may write, whether it's for something as big as our drug-free communities grant, because we know that we have higher rates of drug use in our low income population. Or if it's for something that's even a smaller grant that we're only going to utilize for a year. We did it with our community health improvement plan. We wrote for a grant that allowed the state gave us money to do our big community health improvement plan based on the need that we have in Knox County. And it's all based around the needs of our residents.
Just curious, what is considered the poverty level?
So the poverty level is if you make less than $25,000 a year, you would be considered at the federal poverty guideline.
Is that per household?
It's per household.
Okay.
So, and it differs by family versus individual, and the individual number is, I can't think of it off the top of my head, but that $25,000 is per family. And it sounds crazy to think that, $25,000 is what, you meet the threshold for being in poverty, but we also have this population of people that are not captured by the federal poverty guideline that we refer to as the working poor. And I hate that term, but that's what it is. And it's people who they make over $25,000 per household, but they may have 6 kids at home. They may have, grandma or grandpa living with them that have serious health issues. So they may not on paper qualify as poor, but they absolutely are struggling to make ends meet. And that can be an issue too for if they qualify for certain benefits. There's a level that you are cut off, that you don't qualify for SNAP or for WIC or for things of that nature. So we look beyond just that federal poverty guideline as well, and we look for how many of our residents make less than $45,000 a year per household, and that's included in the census as well.
Well, some of the programs that you talked about are, these are a lot of the common programs that the census has a lot to do with. We've got school lunches, highways, roads, construction, education, legislatures, commissions, congressional districts, hospitals. You wouldn't think how the census is related to hospitals, but it is. Fire departments. Our fire department gets assistance with that. Public health programs that you outline, and housing and public assistance, which is one of the other things that you had talked about. Housing is a problem in Knox County. We don't have enough, and we realize that we need a wide variety of particular types of housing, from low income renters and different various levels of homeowners. We always talk about economic development and working with the business community to try to bring more business in here, who, by the way, looks at census data
Absolutely.
when they do their market research. And so if we want to build jobs here, those jobs do have to go home. And having affordable housing is part of that equation. So let's talk a little bit about the community health assessment, because this is a big deal. I mean, how often do you do the community health assessment, and who are the key partners?
So we do a community health assessment every 3 years for two reasons. One, it is a mandate by the state of Ohio. It's part of our Ohio Revised Code that we perform a community health assessment every 3 years. And our key partners, we have something called the Knox Health Planning Partnership, and it's at its strength when everyone's there. It's about 30 people, 30 agencies, businesses that are represented.
We don't have to list them all.
No, we will not.
We'll skip somebody and they'll be mad. So.
That's okay. The one that we work most closely with is the hospital. And just so Knox County knows, every health department in Ohio has to work in tandem with every health system in their county. So we are very fortunate that we have such a good working relationship with Knox Community Hospital, and we can, work on this, and it fits our needs and it fits their needs as well, because the hospital is required to submit a community health assessment as well. So instead of doing two separate ones, we come together and they submit the same one that we use as well. So they're a pretty key partner in that.
And were you guys alternating at one point? Like one year you would do one and then another year KCH would do one? Or?
No, I think it's always been a joint effort, and
that's good.
And that's how we want it to be. It gets everyone on the same page. We all understand what's going on.
Yep, that's always a good thing. So now, let's talk a little bit about some of the individual stories that you see coming into Knox Public Health, and let's put some faces to the statistics. Who do you see coming in and taking advantage of these programs that we get federal funds we get federal funds in order to provide critical services?
We see everyone, and I'm glad that we do. I think a lot of times people look at services that are government provided, and it has a certain stigma that it comes with it. Our health center, sometimes people may say, oh, it's a free clinic, and that's not the case. We take all insurance, no insurance, and I think that we're starting to see a lot of people come in and take advantage of those services, especially a lot of our students. So if you are a student who is from out of state and you have insurance through your parents, sometimes it's hard to find a provider and network. So our students will come and see us, and they can go, outside of their network, and we'll provide them with care if it's something that they can't get at Kenyon or at the NAS. So that is something that I've noticed a lot of. And I've noticed a lot that our smoking cessation classes have such a wide variety of people that come in. So it really we don't fit a typical demographic of people. It's truly anyone and everyone in Knox County takes advantage of, I don't want to say takes advantage, but they come in and they utilize our services, and I think it makes our county stronger. And for us on the health department side, that's good to see, because the more people that we have that come in to utilize our services, the more differences that we see, the more we learn about our community, and we learn what people need, what people don't need. So as much as we're there as a service for the public, when they come in and they're, getting a smoking cessation class, or they're meeting with WIC, which is our Women, Infant, and Children, we use that opportunity to talk about, what their needs are, and maybe are we meeting them, are we not? So it's kind of it's a two-way street. As much as we serve the community, we really rely on the community input as well to help us kind of move forward with what our programs are going to do. And
so you mentioned WIC. Can you explain a little bit more about that and what all is involved with Women, Infant, Children program?
Yeah, so WIC is it's a national program, but it's state run. So it's Women, Infant, and Children, and it's for moms who qualify for services. So it's money for food, for formula, and you have to meet a certain income level, and they will monitor basically mom and baby up until 5 years of age. And they help with all kinds of things in addition to, it's not just here's money for food for your kiddo. It's let us help you with breastfeeding. It's let's watch. A lot of educational. Yeah. Oh my gosh, a lot of education. And WIC is it's a support group for moms in Knox County as well, And I'm not a parent, but I have friends that are. And when you become a mom, it can feel very isolating because you're trying to take care of your kid, you're trying to take care of yourself. So they've sort of developed this community of moms. They do a baby shower, they have nutrition classes, and it's a lot of education on how can I best take care of not just my kids, but of myself as well. So WIC does some really great things. We also have, we've started a breast milk bank. So that's something that is new to Knox County. And unfortunately, it was supposed to start right around the time that COVID really came through and kind of put the kibosh on a lot of things that everyone was trying to do.
Everything. Gosh,
yes. We have a running joke in my family. We're like, oh, COVID ruined everything. But basically, it serves as a place where we can collect donated breast milk, and then we can send it to the Central Ohio Breast Milk Bank, and that milk goes to babies in need, so NICU babies, babies who maybe mom is not able to produce milk or she's not there to produce milk, and it's a really great and safe way to donate your excess breast milk if you have any, because we know that there's a black market for breast milk, which is interesting. I never would have. I didn't know either until they started to tell us about this program, and we were all blown away. We're like, that doesn't happen. No. So that's something that WIC does as well. So it goes far beyond, hey, here's money for food. It really is a community and an education and a resource place for moms in Knox County.
Well, let's talk a little bit about the food-based programs as well, because you I think hit it the nail right on the head. And people think that we may have a hunger problem here, but it's really a nutrition problem, isn't it?
Yes.
There's a difference in that. And can you explain a little bit about what the SNAP program does and just educational programs about nutrition that Knox Public Health does?
Yeah, so SNAP is Supplemental Nutrition Assistance Program. And there is a big difference between hunger and a lack of nutritious food. So I would say that in Knox County, we have a plethora of food places to eat from.
Yeah.
Are they nutritious? Not always. We have a lot of fast food places. And for a lot of people, especially people who live in downtown Mount Vernon or like the outskirts of Knox County, to have access to affordable, healthy, and fresh food is a challenge because there's not a grocery store with produce available. So what SNAP does is it works to help bridge that gap, especially in our low income population. One of the really cool things that I like about our SNAP program is we have a farmers market, a partnership with the Mount Vernon Farmers Market, where you can use your SNAP dollars for farmers market tokens, and you can shop at the farmers market. So not only are you getting some healthier foods, but you're also keeping that money local, and you're supporting our local farmers, which I think is a great thing to do. But SNAP does also do a lot of nutrition education. And one of the things that, we talk about a lot is especially for our low income population, sometimes the choice comes down to, do I feed my kids or do I pay my electric bill? And sometimes it's much easier to, grab a box of mac and cheese off the shelf.
Sure. Yep.
But that is also an education gap as well. We can explain, hey, look, like here's some really healthy options that aren't, that quick, fast, easy,
Right.
accessible. So it really comes down to how well we educate our population on what is available, what you can do with, fresh local foods. So SNAP, in addition to providing dollars for food, they do focus a lot on education as well.
That's great. And are these classes, are they one-to-one sessions, or how is that?
It can be both.
Okay.
We do, especially for our WIC moms, we do have some individual nutrition education, but the SNAP program does group classes. They also will do cooking demonstrations down on Public Square during the farmers market. They will do nutrition education with our DD population as well. So it's a plethora of things. We can go into the schools if they, want any education for their kids on healthy eating. So they have access to a lot. And we actually have a SNAP educator for Knox County, and he works out of OSU Extension. So he does a lot with the cooking demonstrations and teaching
Paul?
people about. He works with that, but his name is Tanner, actually.
Oh, okay, got it.
Yeah. Tanner does the actual planning of those sessions.
Well, I know Paul Higgins has been around too.
Mm-hmm.
He sort of wants. I don't know if he wants to retire or not, but he's a great chef, and I know he's done some incredible work with the farmers market, and I think working with OSU Extension as well.
Yes, he has. And those cooking demos are awesome because I'm someone who I like to think I know how to cook, but it's always helpful to see an actual chef cook. So I've learned. He's come in, he's done some demonstrations for our agency just at a staff meeting, and it was great. So.
Well, it's interesting. One of the recipes that I got off of Chef Paul was a yellow squash lasagna. I actually made it last night.
Ooh, that sounds good.
Instead of the pasta noodles, I used yellow squash sliced up, and so it was far more nutritious, and I don't get tired and everything like that. So
yes,
it's really
carb coma.
Oh yeah, exactly. Carbs are my weak spot. So
yeah, I'm Italian, so I am made up of carbs, and I'm just made up of pasta.
Yeah, that's how it works. Well, what else can you tell us? Is there anything else about? Oh, I remember what I was going to ask. How much do you work with the schools in your programming and how this all sort of comes together with your educational outreach and the public health partnership?
Yeah, so the public health partnership itself doesn't work with the schools, but our individual agencies that are part of the partnership work a lot with the schools. So for the health department, we do, some nutrition education in schools. We do hygiene education, which sounds kind of silly, but once you hit like 4th and 5th grade and they don't know how to use deodorant, they're smelly kids, So we come in and we give them a hygiene kit. And we separate the boys and the girls so we can give, a little bit more about hygiene and puberty education. We give the girls like a My First Period kit, which is great because, not everyone is fortunate enough to have parents at home or, an adult at home who wants to talk through those things with them. So we do that at the schools. We also do a lot of like car driving safety. We run a Safe Communities grant. So all those stickers that you see, the like drive sober, get pulled over, look out for motorcycles, that's part of our Safe Communities grant, which we also use Census data when we write for that grant and when we report on that grant. And that is another piece of education we do with the students as well, is, not texting and driving and, don't drink and drive. So we do that within the schools. Some of our other partners, New Directions, they do some safe and healthy relationship education in the schools. And we get in there as much as we can. So anything that the schools may ask us to do, we will do.
Well, I know, and New Directions works alongside KSAT and the TAC, the Teen Advisory Council, which is really active. I'm amazed at how much these young people are doing with prevention education, with
it's great.
Addiction and preventing addiction, obviously.
Yeah, it's great. I'm convinced that like this generation of kids will change the world. Like they are so proactive and so like they're so educated and beyond their years.
They get a bad rap though.
Yeah,
but you know
they
what?
do.
We need them.
Yeah.
We need 'em.
Absolutely. I'm a millennial, and we get a bad rap too. Some of it, I will say, some of it is true, but it's awesome to watch these teen advisory council kids, and it's all volunteer, and it's them taking responsibility for what happens in their community. So it's great.
Well, I'm a Gen Xer, and we got a bad rap from the baby boomers and the
Everyone gets a bad. I think the baby boomers got a bad rap from
Sure. So it's one of those rites of passage. You know, who knows what's going to happen when we're old. You know what the next generation is going to be, though. So anyway, well, I wanted to wrap this up by just reminding everybody, September 30th is the last day to take the census. And there are field officers who are going on. If you have not taken the census online yet, field officers will be knocking on your door. A lot of people don't want their doors to be knocked on. They don't like to answer that. So you can still go to 2020census.gov. That's 2020census.gov to take the 2020 census. Last report that we had, I think Knox County was just a little over 70% reporting, which is slightly more than we had from the 2010 census. I think we're at 68.7%. So we're a little bit beyond that. I'd like to be in the high 90s personally.
Oh, I would love that.
So, because anytime we get a chance to get our federal tax dollars back in this community, we have to take advantage of that. And this is a way that each one of us can have a hand in that. So.
Absolutely. And I think that's one of the things that I try to drive home when I talk to people about the census is the more people that complete the census, the better it is for Knox County. And
Sure.
and why not be counted? Like you live here, you work here, you're a member of this community. So, be counted and help us, get the money that we need, get the data that we need to help make this community the best place it can be. It's already great, but let's make it better.
Exactly. And in terms of the number of dollars that are at stake for the country, it's $675 billion a year. Now, the census is good for 10 years, so that's $6.75 trillion over 10 years. And I'd like to get a good, decent cut of that.
Absolutely.
Personally. So,
absolutely.
Anyway.
And I think it also goes, by capita. So if you don't fill out the census, then you're not counted for a Knox County resident, and then that's a little less money that Knox County could get. So I think that's something important too, is that all that funding is based on your population. That's why it's so important to do the census and to be counted.
We're talking with Carmen Barbuto, Administrator, Accreditation Coordinator Extraordinaire from Knox Public Health. Thank you again for coming in and talking about the census and why this is so important.
Absolutely. I will talk about data all day. So anytime.
Okay. I'll hook you up with some people around here. So.
Absolutely.
All right. Until next time, stay safe, stay strong, and stay smart.